try to correct it. As I was telling you, disasters are not seasonal. Disasters don't happen once in a year or twice a year. Disasters happen regularly. Some of the disasters are seasonal, some of the disasters are unexpected, and some of the disasters are created by humans. That means there is some disaster that happens on a daily basis. So that is the fact that you need to be aware of. And number two is about understanding of disasters. See, if we have a better understanding of basic concept of disaster, we will be able to have a better management. Today, I am going to give you an understanding of various aspects with special reference to psychosocial support. As you know, disasters cause a lot of life loss and loss to property. When there is a great deal of loss because of disasters, people start feeling difficult to manage. So when situation is overwhelming, they may not be able to come out of it. So disasters becomes an event which is beyond the coping ability of individuals, families, and communities. So it is very important for us to get prepared at all these three levels. So response doesn't depend upon only government. It doesn't depend only on families. It doesn't depend only on individuals. Every person who is going to be affected by disaster should be educated, should be well prepared. I have prepared a couple of slides which I am going to take you through. And whenever you have any doubts, please stop me and ask your questions. I will clarify the doubts and proceed. So these are some of the areas I'm going to touch upon, like health. Since I work in the field of disaster mental health, I'll be focusing more on psychosocial support and mental health services for disaster survivors. And I will give an overview of mental illnesses, how disasters can cause mental illnesses. And after that, I will cover basic concepts of disaster like definition, types, and different phases. And HRV analysis is another aspect of disaster management, and it is considered to be a first step in the process. And when it comes to biological disasters, we need to know epidemic, pandemic, and outbreak. And there is a brief history of pandemic, how pandemic started, and what are the recent pandemics, and how we have dealt with them. I will be giving a brief overview of that. And COVID-19 pandemic, which all of us have experienced, all of us might not have experienced other disasters, but I'm sure all of us were affected by the COVID-19 pandemic. And I will also talk about how people respond to disasters and what kind of impact disasters have on individual families and communities, and what could be normal reaction, abnormal reaction. As you know, during a stressful situation, people have the tendency of reacting normally or abnormally. I will try to differentiate between the two. And I will also talk about common mental health issues that are commonly seen among disaster survivors. I will also take you through NIMHNAS history. How NIMHNAS has worked in various disasters across the country. And I will also talk about how things have changed in disaster management. It is not the same that we are talking about disaster management. It has evolved over a period of time. Then I will talk about the legal frameworks. Government of India and state governments have formed various policies and guidelines based on which disaster management is carried out in our country. And I will also talk about needs, various needs of survivors during, after disaster, and who is vulnerable, who is not vulnerable, and how psychosocial care can be provided to survivors and who are the vulnerable populations during disasters. And at the end, I will talk about self-care, caring for carers. It is very important. We will be able to help others better only when we can take care of ourselves. So these are some of the important topics that I am going to cover in my presentation. So my first topic is disaster mental health. As you can see in the slide, there is God. Whenever there was a disaster or any adverse event in the society, people would blame the God. People would say, because of God, all this happened. Earthquake, tsunami, or whatever the disaster is. This is what our ancestors used to believe. So they didn't have scientific understanding. They used to say that because of God, it has happened. So we need to do puja, or we need to satisfy God so that he or she will take care of us. But dear friends, that concept did not last longer. In the process of civilization, we have understood disasters in a better way. In the second phase, our understanding was bad. What I mean to say is, people started calling disasters as bad. Whatever has happened is bad. It should not have happened. Even in the recent stampede in Bengaluru, people have started saying that it is very bad. It should not have happened. So that is how people define disasters. But that understanding was there only for a couple of decades. So later in 19th century, people started telling that disasters might cause madness. So when people are depressed, or when people are helpless, when they are not able to eat food, when they have sleep disturbances, those symptoms are considered as mental illness. So it is not the fault of the person, it is not the fault of the situation, it is called mental illness. So that understanding was more prevalent. It was believed to be true till recent times, but now the current understanding has changed. So now whenever there is a disaster, we call it a abnormal situation. So landslide, war, stampede, tsunami, they are all abnormal situations because they are beyond the coping ability of individuals. But what is normal? So whatever we react, in which way we respond to disasters is called normal. So after losing loved ones in disaster, crying is normal. Not having sleep is normal. So not going for work is normal. Not having food is also normal. That means disaster impact is considered to be normal reaction to abnormal situation. So this is the scientific understanding of disasters. Okay, so hope I have made the concept clear to you. In case you have a doubt, you can ask me. Now let us try to understand the definition of health. Earlier, the definition of health included only physical, mental, and social aspects of individuals. After a couple of decades, intellectual, environmental, and spiritual components were also included. But now, definition of health is very comprehensive. It is not only physical, mental, social, spiritual, environmental, but also socially and emotionally productive life. So when a person has a productive life in terms of social and economical aspects, he is considered to be healthy. So when we talk about health, we talk only about I don't have illness, I'm healthy. So I'm able to walk, I'm healthy. I'm able to eat, I'm healthy. That is very old concept. So we should not be focusing only on the physical aspect of health. We should be focusing on other aspects of health also, because they are all interconnected. So next I will talk about mental biopsychosocial model of health. As I mentioned you, so there are biological factors, social factors, and psychological factors which lead to our health. So if there is any problem in any of these domains, there is a disturbance in our health. So we need to have a comprehensive approach or a holistic approach to our health. So when we are teaching our students, we should not be focusing only on physical aspect. We should not be focusing only on academics. So if we are focusing only on academics, it is very narrow. So as teachers, our responsibility is to enable students to have a healthy life. And that is possible only when they are able to pay attention to every aspect of their life, like biological health, social health, and psychological health. And as you know, these are all interconnected. And promotion of health must address all these three components. And there is a concept called nature versus nurture. So I will, give an example. There are two children who are born at the same time, but they are brought in two different families. And in one family, the father is an alcoholic. In the other family, the father is non-alcoholic. So after a couple of years, the child who is in the family where the father is alcoholic, he will become more vulnerable to develop behavioral problems or emotional disturbances. That means both children were same at the birth, but later their behavior or mental health changed because of the environment. So environment plays an important role. So if we don't provide them healthy environment, they will become more vulnerable to psychiatric problems or health problems. So it is, and for example, if you are providing them with a healthy atmosphere in your college or in your school, children will be motivated, children will be very happy to learn. So your behavior and your atmosphere also matters as far as learning is concerned. So you come as part of nurturing. We should have a healthy nurturing environment for our children or for our students as far as our colleges are concerned. And remember that the body, mind, and society are dynamics. They keep on changing with the time. So yesterday we were different. Today we are like this, and tomorrow we don't know how we will be. We don't know how our body behaves. We don't know how our society behaves. We don't know how things change. That means they're all dynamic. They keep changing. That's why it is important for us to accept the change, because change is part of life. Right? And lastly, there are two important concepts that I want you to pay attention to. First one is about our body. As you know, whatever we eat and drink becomes our body. So before we eat, we should decide what to eat. So before we go to a place, we should decide whether that place is conducive or not, whether that place is healthy or not. Because our physical health depends upon in which environment we are living, and what we are eating, what we are drinking. Okay. And the second part is about mental health. So it is our mind. Our mind is influenced by what we see, what we smell, what we touch, and what we taste. Right? So if we are seeing good things, if we are hearing good things, if we are smelling good things, if we are touching good things, then our mental health is going to be better. If we are going to use our mobile phone all the time, so what we do is, we look at our mobiles, we watch videos, we read whatever the mobile is showing us. So we should try to avoid that, because unnecessary information may lead to disturbance in our mind. So before we consume any content, we should be aware of what we are consuming, because that has impact on our mental health. Okay, so we'll move on. When it comes to mental health, there are three aspects: thought, behavior, and emotions. So thought, so what we think, so how we perceive. So if you think teaching is a burden, you will start feeling irritated whenever you are taking class. If you think teaching is enjoyable, I am going to build our student personalities, you will start enjoying, because you think that you are contributing something to society. So if you think that, my job is only for making money, then when there is no money, you start feeling irritated. So it is all your perception, how you take your job, how you take your life. If you think, anyway, I'm going to die one day, what is the point in, living? What is the point in doing all this? Then you'll start having negative attitude towards life. So everybody knows that one day we are going to die. But if we have a positive attitude, if you think that life is worth living, you will start enjoying it. So your enjoyment depends upon how you look at things in your life. So we need to change our perspective towards our students and our life. For example, if you think this student will not improve, if you think this student will not change. So in Kannada, we say, so you uddhara agalla. So when you say you uddhara agalla, then you will not like the student. You will not try to do anything for him because you think that he will not improve in his life. So it is about your attitude. So my students are good. My students are going to improve. My students are going to change. So when you have such attitude, definitely you will make some efforts and your students will also benefit out of your efforts. So your positive behavior starts from your thinking, how you conduct yourself. Okay. And the second aspect is your emotions. As you can see in the slide, they're all interconnected. When you have positive thoughts, you will have positive emotions. So when you have negative thoughts, you will have negative emotions. And these two will affect our behavior. What I mean to say is, when we have positive thoughts and when we feel good, we'll start doing good for others. So in mental health, we talk about these three components. So your thinking should be correct, and your emotions should be healthy, and you should have a adaptive behavior or healthy behavior. So we'll move on. Okay. There are 4 Ds that you need to keep in mind. Disease. This is, for example, depression. Depression might lead, for example, your student is having depression. That is disease. The disease might lead to distress. The person is not comfortable inside. He's not able to come to class. He's not able to pay attention to the class. He's not doing any homework. So he's totally disconnected from others or from classes. That means because of distress, the person may have this kind of emotional reaction. And as a result of that, there will be dysfunction. The person is not able to take care of himself. The person is not able to eat. Person is not able to go out. Person is not able to do anything at home. And at the end, another D is disability. You need to remember 4 Ds: disease, distress, and dysfunction and disability. So, what are the causes of mental illness? So genetic, some psychiatric disorders are caused by genetic. So it can run in families, but not all psychiatric disorders. Only some of them, like schizophrenia, mania. These are some severe psychiatric conditions which are caused by genetic factors. Okay, and there are also some psychosocial factors which maintain those mental health conditions. And other causes are infections. When the woman is pregnant, if she has any biological problems that might affect the child, and brain defect or injury after birth, these problems might happen, and prenatal damage and substance abuse. If the person is taking alcohol or any drugs, he will become vulnerable and he will develop severe mental illnesses. And psychosocial factors: when a person is in stress for a long period of time, he will become vulnerable to psychiatric problems. And lastly, environmental factors. As I was telling you, our atmosphere at home, college, society also matters as far as our mental health is concerned. And the last but not the least is stressful events and disasters, which I'm going to talk about in detail. So disasters can also cause mental health problems. So what is the definition of disaster? Can anyone mention different disasters? Can you name some of the disasters? So many disasters. I have already given you some examples. You can unmute yourself and tell some of the disasters, or you can type in the chat box also, whichever you feel comfortable. I want you to name some disasters.
Tsunami.
Sir, the recent
Okay,
flood
next.
the recent flood which has been going on in the northeast.
Okay, especially in Assam. Okay.
Yes.
Okay, next.
Bhopal disaster, sir.
Bhopal, yes. Okay, that is where we started our work in 1984. Next. That's all. I'm expecting more from your end.
So the Japan earthquake.
I'm not going to give any marks based on your performance in this exam. I'm just trying to understand what you understand of disasters. Please name.
Japan earthquake, sir.
Okay, so recently
landslide, sir.
Japan and Hiroshima, Nagasaki. So next, World War. Next, what is?
Volcano, sir. Indonesia.
Good. So, is there any active volcano in India?
Andaman Nicobar, sir. Andaman,
Okay.
Andaman, not Nicobar, sir.
That is actually mud volcano. So that is a different one. Okay. So if you go to Diglipur, there is a place called Diglipur in Andaman. So there you find. Okay. So not in other parts of India. Very good. Next. Anybody else? I should know.
Sir, can we consider war as a disaster?
Yes, human-made disaster, definitely.
Oh,
So I will
then-
give an example of what happens during war. Recently, I was in Jammu Kashmir. I think all of you are aware of what happened in Jammu Kashmir. Since you mentioned war, I just want to give my experience that I got when I was in Jammu and Kashmir. In April and May, we were supposed to conduct training programs in Srinagar and Jammu. Our first batch training was scheduled in Srinagar. We started our training program on 21st, right? So we started the program and that was Monday. On Tuesday was our second day. In the evening, we came to know that there was terrorist attack in Pahalgam. So all our participants started running from the training hall. So I was totally helpless. I was taking the session and they were totally restless and they had to move out of the training hall. And I couldn't do anything because everybody wanted to be safe. Because when there is a disaster, safety comes first. All other things are secondary. So that's what happened. And we had to cancel next day's training. We restarted on the third day and we completed on the sixth day. So that was over. And there was 1 week gap between Srinagar training and Jammu training. When we came to Jammu, our training program started on time. But again on the second day, in the morning, we came to know that India attacked Pakistan. Okay, so again, the same situation we experienced there. And fortunately, we were able to complete the training, but throughout the training, all the participants were disturbed. It was very difficult to control them. For example, when I was conducting one of the sessions, one of the participants stood up and said, India has attacked Lahore. Then all of them became very, alert. And they started running out of the training hall. That means when there is a war, there is more psychomotor activity. And throughout the night, we couldn't sleep. And, we were not able to eat because there was blackout. And we couldn't go out of the room. We couldn't even look at outside from windows because it was advised that we should not look at the windows. We had to put curtains because if there are drones the windows might break and, we might get injured. And I could see a lot of drones going outside whenever I just, try to look at from some, hole or something like that. Whenever I got a chance, I try to see outside, there were actually a lot of drones. So that time, on my mind, nothing was there. Only, safety, whether I am safe or not. That means war has more impact on our mental health. If you look at what is happening in Gaza, you understand. So people are just, surviving to eat food, nothing else. They can't do anything else. So war is a situation which is beyond our control, and we don't know what is. So war is definitely a human-made disaster, and it has long-lasting impact. Okay. So any other disasters anybody would like to mention?
COVID-19, sir.
Okay, yes, very good. Next. Okay.
The Kurg
thanks for your-
landslides which had happened in
Sorry?
Kurg. Landslide which happened in Kurg,
Yeah, so in 2019 or 20,
18 or
we had
19.
floods followed by landslides. And many coffee estate owners lost their coffee estate, and they had to come onto the street. So that is how a disaster can destroy people's lives. It is not a it is not a life event. It is a disaster. Okay. So thanks for the response. Please let us look at what is there in this slide now. I don't want to read out the entire definition. I just want to highlight the important thing that you need to understand as far as definition is concerned. I have bold it when an event goes beyond the coping capacity of the community, it is called a disaster. Coping capacity. See, whatever you have mentioned, they are all events. Volcanic eruption is an event. Floods is also an event. Earthquake is also an event. Tsunami is an event. So they are all natural events. They happen. So we can't call them disasters. Remember, whatever you have mentioned is not a disaster. They are just events. If you go to Himalayan region, there are many events, natural events that happen. There is snow, avalanches, so rockfall. So these do happen in Himalayan region because they are part of our nature. So if we go and build our houses there and try to live, then it will become a disaster because it will actually affect us. So until and unless an event affects us, it is not called a disaster. Please remember, it is not a disaster. So in definition, it is clearly mentioned that the event should be beyond the coping capacity of the community. When a loved one dies in our family, we can't call it a disaster because we can manage it. With the help of our family members or relatives, we can manage it. When somebody is ill, we can manage it. But the stampede which happened in Bengaluru, it was totally out of control. So nobody could do anything. Right? So it is very important for us to differentiate between a life event and a disaster. So we call an event a disaster only when it is affecting a large number of people and which is totally beyond the coping ability of the community. Please understand this. Okay. So every event is not a disaster. So avalanches, it is a natural phenomenon there. You can't call it disaster. Okay. We'll move on. Why an event becomes a problem? As you know, it is a sudden onset. Some disasters are actually sudden in nature. Some disasters are expected. I mean, during monsoon, we expect that there is going to be a lot of rain followed by floods and landslides. We can expect that. Okay, so we cannot predict. So, am I audible? So
Yes, sir.
Okay, but that screen is black now. I don't know. Anyway, I will continue once. If in case you have any difficulties, please let me know. These are unpredictable. You don't know when tsunami is going to happen, when it is going to rain, and we can't control it. And an event has huge magnitude of destruction. It can destruct property. It can destruct infrastructure, and it causes both human loss and property damage. And as I mentioned, greatly exceeds the coping ability of the affected individuals, family, and community. So next is, these are different types of disasters. Like geophysical hazards include earthquake, mass movement, volcanic activity. And next category is meteorological hazards that include extreme temperature, fog, storm. And next one is hydrological disaster such as flood, landslide, wave action. And climatological hazards include drought, glacial lake outburst, which happens in our Himalayan region, and wildfire are very common. Recently, America had wildfires. Then Japan also has wildfire. Australia has very frequent wildfires. They called bushfire. And the last category is biological disasters. The best example is COVID-19 pandemic. So these are different categories of human-made disasters. But remember that even these natural disasters have human elements involved in it. That means human activity has made these natural disasters more common and more frequent. So next is disaster phases. There are different phases, like before disaster we have mitigation. Before disaster we have mitigation, preparedness, and warning. So basically there are three phases: before, during, and after. Before disaster, these are the three important phases. What we need to do is we need to prevent disasters as much as possible. When prevention is not possible, we should go for mitigating hazards. When mitigation is not possible, we should go for preparedness. And after preparedness, we should have a proper warning systems. Then there is an event. So before disaster, we need to do a lot of preparedness. Unfortunately, that doesn't happen in our country. So what we usually do is we respond to events when they happen. But before, prevention is better than cure. All of you know. Many disasters are actually predictable and they are preventable. When that is possible, why don't we take preventive measures? Why don't you try to reduce hazards? But unfortunately, we don't do. So before COVID-19 pandemic, there were more than 20 pandemics. We did not learn lessons from those 20 pandemics and get prepared for COVID-19 pandemic. We realized only when the pandemic started, COVID-19 pandemic started. That means, and nowadays we have forgotten the pandemic. So we have not taken any lessons from the COVID-19 pandemic and try to prepare for next pandemics. No, we are not doing that because we are not disaster risk reduction oriented. We are more response oriented. Let us see what is going to happen when there is a disaster. So let me, do something at that time. But unfortunately, that is not going to help us much. That is going to create a lot of damage. Okay, so prevention is important aspect in disaster management. We should focus on that. So, is it visible now?
Yes, sir.
Okay, fine. Thank you. Okay, I was telling that it is important for us to focus on prevention. Prevention is possible, and for students, we need to give disaster education. So you heard about health education, sex education, mental health education. Similarly, we have disaster education. This is very important because if children are given scientific information, their response will be much better. Let me give an example. When I conducted one of my training programs in Udupi, one participant told that he was afraid of earthquake. Whenever he saw earthquake images, whenever he heard the term earthquake, he would become anxious. You know why he became anxious? The main reason was that when he was in school, he asked his teacher, "What is earthquake?" The teacher told, "When earthquake strikes, everybody will die." From that day onwards, the child became very anxious. That means he got wrong information. Instead of telling that everybody will die, the teacher can tell that it is a geophysical hazard, and it depends upon its magnitude. So if it is 6.57, it may not cause so much damage. So when on a Richter scale, if it is more than 7, 8, there will be more damage and people will be affected, but everybody will not be, dead. When we give them wrong information, they will perceive it in a negative way. So your role becomes very important. As you know, after parents, children or students believe teachers, right? So giving them proper education or scientific information is very important from prevention point of view. So next one is about hazard, risk and vulnerability analysis. So our response to a disaster depends upon what kind of hazards we have around us and watching what is our vulnerability and what is our exposure. Let me give you an example. In 2019, we had severe floods in Karnataka, and Belagavi is one of the districts which was severely affected. I visited the place and I interacted with survivors. So one of the survivors had developed mental illness. When I took the history, I learned that he was stuck in the water. He was in the middle of the water. He was holding on to an electric pole in that water. He was not able to escape from there. He stayed there throughout the night. So no sleep, nothing, because he can't sleep there. He's holding on to an electric pole and he had to survive. Nobody could go there and rescue him at that time. So morning, people came and rescued him, and he was taken to a nearby hospital and he was given a first aid there. And after a couple of weeks, when a mental health team went and assessed, they found that he developed PTSD. It is a psychiatric condition, post-traumatic stress disorder. That means exposure matters. Another example is COVID-19 pandemic. During the pandemic, healthcare workers were working in the hospital. They had to take care of the patients. Whereas IT professionals were working from home. So they were sitting in their AC rooms or whatever comfortable room they had. They were working from home. So IT professionals were not exposed to the pandemic, whereas healthcare professionals were exposed. That means exposure will decide whether we will have abnormal behavior. Okay, so we need to see whether we are vulnerable or exposed or not. And when it comes to biological disaster, we need to understand epidemic, which is a disease that affects a large number of people within a community, population or region. So it is related to only one region. When it comes to pandemic, it is an epidemic that is spread over multiple countries or continents. The best example is COVID-19 pandemic and many other biological disasters that happened earlier. And outbreak refers to number of cases or diseases that exceed what would be expected. It is called, beyond the surge capacity of the hospital. So hospital may not be able to handle such an outbreak. So we call it a disaster. Okay, I am just giving you a list of all the biological disasters that happened. The first one was in 430 BC. It is called the Athenian plague. After that, you have Black Death. Spanish flu is one of the well spoken about biological disaster. HIV, AIDS, anthrax, West Nile, SARS, bird flu. And the last one was coronavirus. And in future, these biological disasters are going to happen. So it is not the end. COVID-19 pandemic is not the end. There will be many disasters, such disasters in the future. So it is important for our colleges to get prepared. Because your students are also vulnerable, right? And why we had so much anxiety during the pandemic? The main reason was there was an absence of cure. There was no vaccine, and there was lack of understanding among healthcare professionals. We didn't know how to handle the pandemic. Okay, and we did not have short-term plans and long-term plans, so we had to go for lockdown. And the last point is lack of community preparedness. So when I did this training program in Tripura, one of the participants told, disaster management starts from me. But in our society, what we do is we point finger at government. Government has to do everything. No. So disaster management is possible only when we take initiatives. So community preparedness or individual preparedness is very important. So our responsibility is very important, and there was more confusion, uncertainty. We didn't know what was going to happen next. So after lockdown, what will be next? So whether it is going to come back, we didn't have any understanding. And it was human to human transmission. So we had to avoid other people. So we had to have physical distance from others. And there was sense of helplessness. So our relatives were suffering, but we couldn't go and help them. And when our loved one died, we couldn't go and cremate their bodies. And healthcare professionals or ambulance drivers did that work. We couldn't go to that place. That means there are a lot of restrictions, right? So there was no vaccine. So we felt very anxious, and these were the stresses which were highly prevalent during the pandemic, like comorbidity. Those who had comorbidity were more vulnerable. Lack of community sense and work. Those communities which did not have any understanding of the pandemic became more vulnerable. They were actually not following any COVID-19 protocols. So it was actually difficult for them to survive or difficult for them to lead a healthy life. And bereavement, dislocation and separation from loved ones, aged parents, we were more concerned about our parents' safety, not ours. So my parents are aged. What if they are infected? How I am going to take care of them? Where I am going to arrange ICU bed for them? So these are some questions that we had in our mind, and these are all called anxious thoughts. So anxiety causes such thoughts in us, and migration. People who were migrated were more vulnerable, and dysfunction is another problem that people had. Severe social exclusion, threat to life there was, and unemployment, poverty, and lastly, poor support systems had caused a lot of distress. Those who had good support system were able to cope better. So next is about common reactions when there is disaster. What are the common reactions that we see in people? So the first reaction is fear, nothing else. See, all of us want to leave. Nobody wants to die. Is there anyone who wants to die? See, it's a very, very, very basic thing that we need to understand. All of us want to survive, even though we know the fact that one day we are going to die. All of us are aware, but still we want to live, right? So when our actual life is at risk, the first psychological reaction is fear. What is going to happen to me? How am I going to survive? I was giving you Kashmir examples. I could see only fear, nothing else. That means our safety becomes the first priority. And they will have overwhelmed emotions. So being anxious or being worried is a normal emotional reaction, but those emotions will be overwhelmed. I mean, beyond expectation. Usually people may not have that kind of emotional reaction, but when there is a disaster, they will have overwhelmed reaction. Okay, anger. That anger might affect the person himself or herself and others. And there will be a lot of confusion. I don't know what to do. How can I come out of this situation? I'm totally helpless. And people start taking substance to cope with the emotions. So they think that, if I drink alcohol, things will be fine. If I smoke, I can reduce my stress. So that is a misconception people have. I would like to give an example of what happened in Bangalore. So after lockdown 1, all bars and wine shops were opened. And immediately there was a huge queue in front of all bars and wine shops. And there were both men and women in the queue. Don't think that it is only men who drink. In Bangalore, we have seen women also standing in the queue for alcohol because they couldn't have alcohol for a long period of time during lockdown. So immediately when shops were opened, people went and stood in the queue for alcohol. That means they wanted to overcome their emotions by taking alcohol. So people use it as a coping. But unfortunately, this is a negative way of dealing with the situation. And some people might deny it. Does that happen? They may not be able to accept it. It's a psychological denial. And they feel distress. And they may also have increased sleep or decreased sleep. Lastly, but very importantly, is lack of concentration. Children may not be able to concentrate on their studies. We have seen that during lockdown. So many of our students were not able to do homework. They couldn't attend online classes. And after the pandemic, we went and did a study in Jayanagar College. So we have one college, Bharat Education Society. We went and did a study there. We found out that after the pandemic, many of the children had concentration problems. And another problem was that they had forgotten most of the things that they had learned before the pandemic. So memory problems will be there. So 2 years out of the class. So no in-person classes. That means children will actually forget. So they have lost their daily routine and they are not able to keep up with their studies. Remember that during a disaster, this is what happened to the students. So they may not be able to complete things on time. Okay, if you go back and do a study with those students of yours who passed during the pandemic, you understand that they have some difficulties still. In some subject, they may have difficulties. They may have difficulties in recalling. So that means pandemic had affected them severely. Okay, they passed. That's a different matter. But when you try to understand whether they were affected mentally or not, you understand that there is a lot of impact because of that. And as I mentioned, these are all normal reaction to abnormal situation. Okay, so next one is about various factors that determine people's reaction to a disaster. So the first one is about disaster-related factors such as magnitude, occurrence type. Magnitude, as I told you, if it is a minor disaster, it may not affect severely. Okay, it is fine. People will be able to move on. And if it happens, for example, earthquake happens during night time, many people will die. If it happens daytime, there will be less sectional impact, less sectional life loss. So it depends upon what kind of disaster it is and how often it happens, when it happens, and where it happens. And next is survival related factors. Is children are more vulnerable because they're not able to comprehend what is happening to them. They are totally confused. They are dependent on parents. That's why parents should be strong during disasters. If parents are anxious, children will become more anxious. So parents, father and mother, if they are anxious, children will get confused. Something is going to happen and will not be alive. So they will have such a emotional reaction to the event. So it is important for parents to be confident and calm during a disaster, because you are the role model for your children. So that is very important. Gender, women are considered to be more vulnerable, but they are found to cope better than men. When a disaster happens, men start taking more alcohol. When it comes to women, they start sharing with others. Sharing is caring. We unfortunately blame women for talking with others, for sharing with others. That is their strength. We think that women gossip with others. That is not gossiping. That is caring. So when you share with others, what happens is you are ventilating and you are feeling better. So after disaster, we should allow people to share as much as possible. We should not keep it to ourselves. And next point is about exposure, whether people are exposed to the event or not. So our reaction depends upon how much we are exposed to the event. And our personality, if we have anxious, avoidant personality, we will be more affected. If we have very, easy taking personality, we will take it as any life event. For example, in Greece, there was a wildfire, and one of the farmers lost his crops. He lost his, his agriculture equipments. And a TV reporter went and asked, "You have lost so much. How are you feeling now?" He said, "Yeah, I lost." He was about to tell about the loss, but suddenly he said, "I don't want to talk about the loss. I want to rebuild." So there is no point in talking about the loss, right? It has happened. So instead of talking about would have, could have, you should delete these three words. Would have, I would have done, I could have done, I should have done. These things are not going to help you at all. So I will rebuild, I will bounce back, I can come out of it. So when we have such attitude, we will be able to come out of any kind of life event, including disasters. Okay. So next point is coping. Whether people have positive coping or negative coping, it depends upon their personality and their past experiences, and support systems are very crucial. And the last point is about community. So level of preparedness, how much the community is prepared, and past experiences and leadership influences and community reactions. If there is going to be pandemic again, we will be able to respond better because we have past experience. We know what happened during the first lockdown, second lockdown, how we came out of it, how we handled online classes, how we took classes. We know all that. Then there is going to be a pandemic again. We will be able to respond better. It will not take us much time. So past experience also matters. And next point is about the brain. As you can see in the slide, the brain is going to be severely affected because of a stressful condition for a long period of time. So when the brain is in the stress all the time, what will happen is its structure will change. So it may not be able to function like before. It will not be a normal brain. It will become abnormal brain. So staying in that kind of state of mind for a long period of time is not advisable. We should try to come out of it as early as possible. As a teacher, you should come out, and as a teacher, you should enable children to come out of it. I mean, after disaster, you conduct one debriefing session, ask children how they are, what they are doing after disaster, how their lives are. Are they able to study? Are they able to concentrate on their studies? How are their family members? If we can conduct one brief session with students, they will be very happy because you can help them out. See, as a lecturer, your job is not only teaching, but also taking care of students' mental health. So after disaster, it is expected that their mental health is affected. So if you can conduct a brief session with them, you don't need to be an expert in mental health to do that. So using your common sense and your experience as a teacher, you can do that. Just talk to them how they are feeling and what is happening. So we can prevent this kind of brain damage. Now I will talk briefly about what kind of impact a disaster can have on people. The first one is psychological impact. So people will actually will be they will have irritation, loss of interest in life, reduced activity. They may not be able to sit in one place. As I told you, people use substance to cope with emotions, and they will be more preoccupied with the pandemic. So pandemic or no disaster, and they keep on worrying about their future. I have lost my loved ones. How I am going to rebuild my life? Yesterday I watched some videos of the stampede survivors. So they were telling that how we are going to lead our life without our son, without our daughter. We spent all our money for educating our children. So some of your students, parents may have such doubts. So it is very important for us to identify their worries. And if they are not able to find any solution, people will start giving up. Okay, I tried my level best. I can't do anything. They will lose hope. And as a result of that, they will start committing suicide. Remember, after event, people try their level best to come out of it. If they are not able to, they will think that ending their life would be the best option. So before they reach that stage, it is important for us to identify them and help them out. So during and after results, we know that many students try to commit suicide. After disaster, this might also happen. Okay, and these are all other psychological reactions like fear, helplessness, feeling sad all the time, being hyper vigilant, having anxiety, suicidal thoughts, anger towards self and others, crying with a fear of getting infected. This happened during the pandemic. Sleep disturbance is one of the common problems among disaster survivors. They're not able to sleep because they think their life is destroyed. They think they may not be able to rebuild their lives. So when that thought is going on in the mind, they may not be able to eat properly, they may not be able to sleep. Their body is fine, but mind is disturbed. Okay? And they always have increased heartbeat because of anxiety. The anxiety is one psychiatric conditions where you see a lot of physiological changes. Increased heartbeat, tremors in hand, dryness of mouth, sweating, and restlessness. So these are all physiological reactions. And when it comes to social problems, social stigma is the displacement of loved ones and family members that happens, changes in roles and responsibility, disagreement, unemployment, and social distress. Okay, and family is also disturbed. And these are actually different people who are affected during disaster. It is our family, children, parents, spouse, relatives, neighbors, colleagues, community, religion, values, social stigma, poor social support, reduced social life, no recreation, no job. So if these things are affected, how are we going to lead our life? When our family is not safe, do you think you will be able to go to college to take classes? No. You can't do that. So our mental health depends upon all these people. If they are okay, we'll be okay. So we need to take care of them so that they will take care of us. And these are some physical impact like headache, tense muscle, palpitation, poor appetite, overeating, sleep disturbance, reduced activity, tiredness, and lack of energy. These are all called psychosomatic responses. When survivors go and get medical examination done, there will not be any pathology. There will not be any physical problem. This happens because of psychological problems. The people are mentally disturbed, and those psychological problems are manifested through their body. So we call psychosomatic. Soma means body. So they express their distress through their body. So we need to understand whether this is really a physical problem or it is a psychosomatic response to a disaster. Okay, and financially also people are affected. This is what we have seen during the pandemic. And these are all long-term mental health problems. Like, as I mentioned, people start smoking to overcome their emotions. They consume alcohol. Family violence. One event happened during the tsunami. What happened was there were two children in the family, and when the tsunami happened, father was not there. Only mother and the two children were there. Unfortunately, the mother was not able to save one of the children. So one child washed away in the water, and she was able to save the other child. Later on, what happened was her husband started beating her, blaming her. So because of your irresponsibility, we lost our son. So you should have been more careful. You did not do enough to save our child. So this is actually one family violence which happens after disaster. So when a child is not eating, when a child is not going to school, who is blamed? It is actually mother who is blamed, not the father. Father doesn't take responsibility. So father thinks that I am taking care of the family's financial aspect and that is my responsibility, and mother has to do everything. No. So this kind of problem can be prevented if there is gender equality in sharing responsibilities. And so wife beating and child neglect happens by father. We did one study with tsunami survivors. We found out that after the tsunami, and those men who lost their lives, who lost their wives, got remarried. And what happened to their children? So they became an orphan. But women who lost their husband did not get remarried because they stayed with their children. So that is the main difference between men and women when it comes to not men and women, mother and father. So mother takes care of children, and we have seen in relief camps that in Kodagu, we have seen in relief camps, and I was in Manipur. There also have seen that mothers make sure that their children eat first. They make sure that their parents eat first. After that, if something is left, they will eat. Otherwise, they go, hungry. So that's the difference. Okay. And so these are all normal reactions. Like crying is normal. So denying that it has not happened is also normal. And after some time, survivors may have some unwanted thoughts in their mind. The thoughts or images related to the disaster keep coming to their awareness. And how long? It will be only for 6 months. After 6 months, people will accept and move on. Okay, we can't do anything. We have to move on in their life. During the pandemic, we lost our loved ones. Are we still worried about them? No. We are actually moving on. It is human nature. Because when our parents lost their parents, they had to move on for our lives. And when we lose our parents, we will have to move on for our children. That is how things go. So in a forest, when animals die, the other animals don't stay there crying. What they do is after some time they will move on, because if they don't move on, they will be attacked again. So it is natural that they will actually move on, right? So remember now.
Yes, sir.
Oh, fine. We have, yeah. So instead of being stuck in that event, it is important for us to move on, because we can't change the past. If it has happened, we need to accept and move on. If we don't accept, that thought is going to be there in our mind. Okay. So next category is abnormal mind, abnormal reactions. overwhelmed, panic, exhaustion, extreme avoidance, not facing the disaster affected areas, not talking about it, and having physical complaints like headache, stomachache, and students may complain that they have a stomach problem. I'm not able to concentrate. I'm not able to do homework. So I am feeling sleepy. So these are all called psychosomatic responses. So they are called abnormal reactions. And the last point is character distortions. If they stay in the same state of mind, they will stop developing character distortions like PTSD, depression, anxiety disorders, which are considered to be severe mental illnesses. So it is important for us to prevent our student from developing severe mental illness. Early intervention brings better outcome. As early as possible, we should try to help them. Okay. So here you can see reactions and the duration. The longer duration of symptoms, the more severe the problem will be. Okay. We should not allow the problem to grow further. And there are some principles which we need to be aware of. Okay. And these are the principles based on which disaster management is done. The first one is everybody is affected by disasters. Rich, poor, women, children, person with disability, person without disability, everybody is vulnerable. We can't say that I'm totally healthy and I will not be affected by any disaster. I will go and face it. Don't do that kind of adventure, because anybody is vulnerable. Even if we are physically fit, may be vulnerable. During this stampede, there were many people who were physically fit. They couldn't do anything. So we should not take risk by thinking like that. Okay. And there are two types of trauma, namely individual and the collective trauma. See, when we have lost our family member, it is called individual trauma. But then there are many people who have died in our community, in our village, or in our district. It becomes a collective trauma. The suffering is not only in my family, but also neighbor's family, but also in the neighbor's village. So that is called collective trauma. And when there is disaster, it is local people who respond better. And they are the first responders. Before NDRF goes there or before SDRF goes there, it is local people who try to help the survivors. But remember, they will not be able to help survivors longer because they don't have enough knowledge, enough experience, and enough resources. So it is important for us to get external support from government or any other agencies, right? So, and remember, these are all normal reaction to an abnormal situation. And lastly, support systems are very crucial for recovery. The stronger the support system, the better we will be able to respond to any kind of event. So we need to build such support systems for facing any kind of disasters. And these are some common problems that people face during biological disasters. Insecurity, uncertainty. We don't know what is going to happen tomorrow. And because of that, they will have fear and confusion, and they will keep on worrying whether my son will pass or not, whether my son will go back to school or not, whether the pandemic is going to get over or not. People will keep on worrying about the situation, and they will not be able to do any work. And this slide talks about the history of psychosocial support in India. Okay, we started with Bengaluru circus tragedy. And we have worked in almost all disasters that have happened in our country, including the COVID-19 pandemic. And I will talk a little bit about NIMHNAS. I work in this department. It is called Department of Psychosocial Support in Disaster Management. We have multidisciplinary team which is working in different areas of disaster management. And this department is sanctioned by Government of India, and we are responsible to provide psychosocial support in all disasters across the country. Okay. And in case you need any training programs in your college, now it is going to be mandatory for all colleges to have disaster management plan. Hospitals should have, colleges should have, and schools should also have school disaster management plan, college disaster management plan. And there is going to be two chapters in in syllabus. Already some university syllabus has 2 chapters in degree or in even colleges. These are going to be future topics. So you need to be aware. And in case you need any help from our side, please let us know. We will see how we can help you out. Okay. And these are some frameworks which are developed for disaster management. Earlier it was response-centric approach, but now it is disaster risk reduction centric. That means we should do our disaster management before any event happens. We don't need to wait for a disaster to happen. We can do a lot of work before that. And you should be aware that there is a Disaster Management Act 2005. And when the disaster, DC has power to implement this act. Okay, he can take any kind of decisions to handle the situation. And there is a national policy on disaster management which provides guidelines on how disaster management can be done in our country. And there are also some guidelines on psychosocial support, how mentally people can be supported. And these are some assessment methods that can be carried out for disaster survivors. You should accept the survivor, do brief assessment, try to understand what their problem is, and do brief mental status examination. Based on that, you will be able to make a diagnosis, and then we can have treatment plan. After that, follow up. Okay, so these are some needs of survivors. The first needs are physiological needs. In Gaza, people are asking only for food, nothing else. That means physiological needs are first. So after that, they think about safety. Then belonging and social connection, and lastly self-actualization. Only a small fraction of people may be able to get self-actualization. Most of us are in the third level, belonging and social connection. So we think about our food, safety, and with our family we want to spend time. That's all. And to some extent we will go for self-esteem. It is difficult for us to go beyond self-esteem. Self-actualization is the final stage where people will have stress-free mind, and they will not have any detachment with their family or property. So, for example, Gautam Buddha was able to get self-actualization. Okay, you can also try if you want to reach that stage. It's possible. Okay, and we have some training models in enhance. 1-day training model, 2-day training models. I've already spoken about prevention, mitigation, and preparedness. And finally, it is a spectrum of care. Disaster management is not one-man show. It should involve various stakeholders like doctors, engineers, revenue department persons, Anganwadi workers, ASHA workers. When we provide spectrum of care, we will be able to help survival come out of it. So what we need more information about disasters, and we should also have solidarity and more action. Unfortunately, we have a lot of information. We may also have solidarity, but less action. Action should be more. How to help our students during disasters? Very simple strategies. You will be able to do it. Listen to them. You talk less, you allow them to talk more. And you provide comfort to them. When they're anxious, worried about their studies, you just tell them, be relaxed. Everything will be all right. We are there to help you out. And you give them reassurance. This pandemic is not permanent. This disaster is not permanent. Your worries are not permanent. So you will be able to come out of it. You just, be confident, be hopeful. We are there to help you out. These are 3 simple techniques that you can use to help your students. So there are 3 levels of support system: primary, secondary, and tertiary. Primary includes our family members, secondary includes our friends and relatives, and tertiary includes our government and NGOs. Your college is part of tertiary support system. Students come to your college and you are a teacher for them and you act as a tertiary support system for them. Some student may not be comfortable talking to their parents about their problems. So they come to you as a teacher because they trust that you know the issue and you will be able to help them out. Okay. So be ready to provide them counseling. So these are some basic techniques which you can use, like allowing them to talk more and listening them actively instead of you talking more. Usually what we do is, as teachers, we talk more. We think that a student don't know anything, we should talk more. Please don't do that. They also know things, especially when they are distressed because of a disaster. You should allow them to talk more and you should listen to them actively. You should empathize with them. I want to ask all of you a question. You are all teachers. You have seen many teachers in your life, right from your primary education till whatever study you have done, master's, PhD, whatever you have done. You have seen many teachers in your life. Do you remember all of them? Do you call them and wish on Teachers' Day every year? Do you do that? How many of you do?
To some of our teachers will do, sir.
Okay, only some of our
Yes,
teachers.
sir.
So why not all teachers?
So for some of them we don't remember, and some of the
Okay.
teachers we remember because they were our favorite teachers, maybe because of the way they taught
Okay.
us.
Okay.
And at some point of time they have some influence on on us during those days. So maybe
Okay.
because of the way they teach, or they might have influenced by their teaching. So whatever the fact may be, so for some of the teachers we remember, and we do wish them, or for some of them we do message and we wish them at some point of time.
Okay. Good. Good. So anybody else? Any other perspective?
Sir, some emotional attachment we had with some teachers, sir, that
Uh-huh.
made us connect to them.
Yes. See, those teachers whom we still remember, whom we wish on Teachers' Day, or whom we call and ask how they are, have helped us when we were in difficult situation. That means they had empathetic attitude towards us. So if you want to be remembered by your student, please develop this attitude, empathy towards your students, trying to understand their situation, their point of view. Okay, so remember, all of us have only one life. And you have got a great opportunity in your life as a teacher. So if you want to become a great teacher, it is possible. And that is possible only when you have empathetic attitude. You may be knowledgeable, you may be skillful, you may be very good at teaching, but you may not be a hero if you don't have this attitude. So you will become totally a villain in the eyes of students. So they will like your classes, they will understand your subject, but they may not be able to like you if you don't empathize with them. So from today onwards, try to put yourself into their shoes and see. Once upon a time, you were also a student. When you were a student, your teacher empathized with you. Now you are a teacher, please empathize with your students. Especially after disaster, you have to empathize with your students. You ask them how they are, what they are doing. You don't need to spend money. You don't need to spend any other resource. You need to spend some time asking them how they are. So are they okay? Whether they had food or not, whether they are able to sleep or not. If you ask such questions, they will feel heard. They will feel relaxed. Oh, my teacher is asking about my safety, my health. That's really good, right? So please use this empathy. And fourth technique is engaging them in productive work. Empty mind is devil's workshop. After disaster, if you don't do anything, those unwanted thoughts keep coming to our mind. We'll be thinking about the loss only. We'll think about the pandemic. We'll think about tsunami. So those thoughts keep disturbing us. The best mechanism is to engage ourselves into some productive work. So reading a book or cooking or doing some homework. So if we don't do that, then we will be more disturbed. And next point of relaxation, yoga can also be done. And we should create support system. And lastly, spirituality. Regarding spirituality, I just want to give I want to share my experience of what happened in Indonesia when I got a chance to go to Banda Aceh, which is in the coastal area of Indonesia. I went and conducted meetings with tsunami survivors. I went to many villages and conducted meetings there. And I asked them a common question in all meetings. My question was how they were able to come out of the disaster. Most of them gave me the same answer. In most of the villages, I had the same answer. What was the answer? Can you guess? What answer they might have given to me? Yes, anybody can guess? Yes. I'm asking a very simple question. It is not a rocket science question. It is not a biological question. It is a very common sense question. Yeah. Anybody would like to answer my question? What answer they might have given? Yes.
Meditation,
Any
sir.
guesses? It doesn't need to be correct answer. You just share your perspective. I'll be very happy. Please. Pooja is about to say something. Please go ahead.
Is it meditation, sir? Meditation.
Okay, good. Yes. Anything else? Anyone else? Any more guesses? When I asked them that question, they said, God had given us everything. He has taken it. He will give it back to us. That was over. That means they had accepted the loss and moved on. So when you can't do anything, it is better to leave it and move on. Leave it to God and move on. Finally, you need to do that. Because I just want to ask all of you, if I'm placing a hot potato in your hand, what will you do? I think you will be able to answer this question. I'm placing a hot potato in your hand. What will you do? Yes.
We will throw off, sir.
You throw it off. Okay. So Hindu says you'll throw it off. Anyone else? Yes. Anyone?
This is MMTTC.
Huh?
This is lunch break, sir.
Sorry?
Lunch break, sir.
Lunch break. Yeah. Just 2 minutes. I'll complete. Okay.
Okay, sir.
Just last slide. Okay. After this question, Yes. Any more responses? Hot potato. So I'm placing a hot potato in your hand. What will you do? So Bindu said she will throw it away because it is very hard. You can't hold it in the hand. Next.
ಸೈಡ್ ಅಲ್ಲಿ ಇಡ್ತೇವೆ ಸರ್
Side
ಒಂದ್ ಕಡೆ ಇಡ್ತೇವೆ ಹೌದು ಇಟ್ಟಿರ್ತೇವೆ ಸರ್
ಯಾರು ತಿನ್ಬಹುದು. Okay, good. So why to throw it? So anyway, it is going to cool down. We will keep it aside and we will eat it later, right? So that's what Pallavi is telling. Okay, good. Next. Any more guesses? I know it is lunch time, but I will take up few more responses, then I will conclude here. Please. So hot potato in your hand.
Sir, maybe we'll drop it off. We'll not throw it away. Maybe we'll drop it off from the hand, sir.
Yeah. So next. I want everyone to speak. Yes, anyone else? Yes, anyone else? Okay. So when you, the situation is the same, but responses are different. Some wants to throw it away, some wants to keep it aside, so some want to leave it there itself. That means, so your response depends upon your understanding of the situation. But unfortunately, you cannot keep the hot potato in your hand. So the longer you keep it in hand, it is going to burn more. The same thing is true as far as mind is concerned. The longer you keep your mind in stress, the more it is going to burn. The earlier you get rid of your stress, the better it will be. Okay, so when there is a disaster, if you are disturbed or if your students are disturbed, please try to help each other or seek professional help. So now we have TeleManas number is there. If you type in Google, you'll get TeleManas number. It is available 24/7 in all Indian languages. If you are from Karnataka, it is available in Karnataka. We have 2 cells in Karnataka. One is in Bengaluru, NIMHNAS. The other one is in Dharwad. Okay. So your students can call at the helpline and seek help. This counseling is available. Try your level best. If not possible, please seek professional help. So nowadays, treatment is available or counseling is available for all kinds of psychological problems. We should not suffer within our mind. So there is help available outside. And if we seek help, we will be able to prevent suicide or any kind of psychiatric problems. Okay. So with this, I will conclude here. And I have taken 5